Hi, Dr. Garima here, and yes, I'm recording a video after a long time. After almost 3 years, I went for my first vacation. Vacation, what I was really anxious because I was traveling with my toddler alone. He's just 3 now, but my parents were there. But still, I was like so skeptical that I'm going to Europe, and I'm a vegetarian, so I was like, how am I gonna give him food? And though we were in a group travel, and we had a cook and all with us, still I was a little scared because he's a very active toddler. But anyways, it all went well, and thankfully we were all good, and the trip was uneventful, smooth, just a lot tiring and exhausting. I returned yesterday night, late at night. Today I just managed to unpack everything and get groceries for home. There was literally nothing in the fridge. So, yeah, but before going to sleep tonight, and during this vacation, I was thinking, sometimes when you're just doing the work again and again, like in a loop, you just lose sight of the bigger purpose of life. Like, I did some soul searching basically. I've come back relaxed because this 11 days there was no clinical work. It was just managing my toddler and looking outside the bus window, going through five, six different countries in Europe. Uh, and receiving messages and emails as usual, which I was replying as and when I was getting internet. But one of my soul searching meditation when I was doing, it did come across to me that I do feel a lot energetic and happy, and that's how other people also respond when one of the purpose of my soul perhaps is to teach. This is my way of serving the humanity. This is my way to serve through my voice, through my knowledge. So I was like, let me, just continue to do that without any expectations, if it's helping and if it's serving humanity selflessly, helping any student pass the exam and fulfill their dreams and progress in their life, that is also serving, right? It doesn't have to be like just giving money. This what I'm doing has deeper meaning too for others and myself too. So yeah, long story short, uh, it's almost 12 midnight here and I want to go to sleep, but I was like, no, let me just shoot one video, just 5 questions, and then I'll go. So if anybody is watching this and it helps them out, great. So anyways, let's get back to the exam. Okay, so this is the new book that I prepared. New book, as in it's been almost a month, more than a month since I've published, and I'm getting great reviews about it. Like one of the candidates today messaged like this is a great book, and she really enjoyed going through it as the questions were bang on spot with proper options and answers. So I'm also preparing another book which is subject wise, which is going to be a huge book, but that is still going under process. But in the meanwhile, I thought, why not start with the topic which I've given in this book, one of them. Ethics and professionalism. Yeah, I thought, why not discuss this, because this topic is the one where I get most of the candidates' questions, because there is no particular textbook about it. The ADC resource gives articles and articles, like 3 4 different articles, and you're supposed to just go through that information. But when questions are fabricated from that information and being asked, still candidates are getting confused. So what I did was I went through those articles and I made very good questions. I mean, which I have given in this book, almost 50 of them, which is a huge number because you practically don't get any questions on the ADC resource articles on ethics and professionalism. And these are very, very important questions. As if you mark these questions wrong, you will flunk your exam, because ethics and professionalism are a core aspect of you being a dentist, and especially you being a dentist in Australia, right? Because you're giving the Australian exam. So all the questions are made on these topics. I thought, why why not just start discussing some questions and like finish off the 50 questions in subsequent days, so at least you will have all the ethics and the professionalism questions with you. Of course, it's always best to have the book and study it and revise it, because seeing it once is difficult, and to remember, like, revision is the key. I feel to remember anything, you have to study it 5 times, minimum 5 times. I mean, at least that is required for me. Even though I feel I have a bit of knowledge, not, of course, not the entire knowledge, I'm still a student, but even having been understanding concepts, I still want to revise 5 times any new thing, so that it just gets integrated and imprinted in my brain, and then I can access it whenever I want, and it becomes a part of my daily based practice. Only reading is just forgetting eventually. So, anyways, so I have different topics in this book related to public health dentistry, the hot topic of this last March 25 exam, from ODL therapeutic guidelines, infection control, consent, so many questions, and the COVID-19 questions as well. But right now I'm just jumping directly on to the ethics questions. Okay, so let's just solve 5 of these questions. Patient refuses treatment that is clinically necessary. What is the dentist's ethical obligation? So if you have a patient and you have done your clinical examination, and suppose you find that one tooth is really, really bad and it needs an extraction, there is no other way, and that tooth is causing an abscess or whatever, and you inform this to the patient, but the patient refuses, even though it is clinically necessary and you feel that it's going to cause more harm if it's there and the treatment should be done, but still the patient refuses for the treatment, whatever the reason. Maybe fear, maybe finance, maybe just not wanting to do it. What are you going to do? Are you going to proceed with the treatment anyway? That's force. That's forceful treatment. Respect the patient's autonomy. Report the patient to the health authorities. Convince the patient using pressure. Now see, proceed with treatment anyway, you cannot do. That's practically kidnapping and forcefully giving the treatment. No, you cannot do that. Respect the patient's autonomy, yes. Report the patient to health authorities, no. Why? Because if you do that, you are still breaching the patient-doctor confidentiality, and that is none of your business. Like, if the patient refuses, the patient refuses. It's the patient's choice, it's his body. So even though you may be really concerned about the patient, and even if you may feel that, if I report to the authority, what is the authority going to do? Kidnap the patient forcefully and do the treatment? No, it's not going to do. In fact, when the authority will get back to the patient is going to feel very, very upset, because you breached the confidentiality. You understand my point? So you cannot report the patient to the health authorities. He's not done any harm to you. He's just respecting his body and refuses the treatment on whatever grounds. He doesn't have to explain you that. Convince the patient using pressure. No, what are you? An extortionist? No, there is no convincing the patient using pressure. See, I'll tell you one thing from my experience. There are times when I get patients and they want to refuse the treatment, and especially in their children, when I see there is an abscess happening and the patient is like, oh, but it's a milk tooth, it's going to fall off. And I know that is not going to be the case soon, because the child is just 4, a molar is infected, and it has to be taken out, and the child is on and off crying in pain, but the patient still refuses the treatment. You're not going to make a face, you're going to respect that decision. And you will be very, very dignified in your response. You will be gentle, empathic, and you will try to understand the situation even if you don't. And you'll always tell the patient that you respect their choice, and that you're always there in case they wish to change their mind. You will never demean them or reprimand them or scare them. Unfortunately, what I'm seeing nowadays in corporate practices, doctors are trying to just scare the patients, If you don't do this, this is going to happen, types like putting them under pressure. No, you're not going to do that. You're going to do your job, okay? Your job is to inform. Your job is to respect the patient's decision. and you have to make the patient feel comfortable and not inferior due to whatever reason. The patient is choosing not to do the treatment right away, but you are going to be helpful to them so that even when they want to change their mind later on, they should not feel, oh, this doctor had told me, if you don't get the treatment and blah blah blah, and I'll have to search for other doctor because I feel embarrassed going back to that doctor. No, you're always going to leave your doors open very respectfully, very kindly, so that whenever the patient feels the need that now is the right time for them to do the treatment, they're going to come back to you. And this has happened so many times with me. I've been very respectful when the patient has refused to do the treatment, and later on, when the things are getting out of control for them and they want to get the treatment done, they don't hesitate to come back to me. And I never tell them, see, I told you so. No, I respect their situation. I don't know what their situation is. I'm not going to judge them. It's my job to give them the options, explain them the consequences, and tell them that I'm always there for help whenever they choose to get the treatment done. This is how you're going to manage a patient. If you develop that kindness, that empathy, you will never have any dearth of patients. Your practice will boom. And I'm not saying for the financial aspect of it. A good doctor, a good healer basically, always just heals with kindness and with peace. Nothing, there's no other emotion. So if you do that, you're going to be very, very satisfied in your practice. That's what I'm trying to tell you. So this is my take on the first question. Second, a dentist offers a patient an expensive cosmetic procedure without discussing less costly alternatives. This breaches which ethical principle? Again, this I'm seeing a lot, many times being done. A patient comes with a little bit of, say, crooked teeth, say 2 central incisors or a little here and there. And the patient will come to us for a third or a fourth opinion, and they'll be like, what, I visited 2-3 dentists and all of them said, I should drill my tooth, I should do an intentional root canal, and then the crowns will be given, and only then my teeth can be straight. And I want the teeth to be straight. No other option has been given to me. Again, it's a very sad story that's been happening, but this is what is happening. What is your job? Your job is to give all the options. So many times when patients come to me as their first appointment and say a tooth is pulpally involved in their child, I take an X-ray, etc., and I tell them, what, you have 2 options. Either you can do a root canal or you can extract. So when I'm just on the first option that you can do a root canal, they're like, let's go for it. And I'm like, no, but you have to listen to the second option, Even though you're ready and eager to go for the root canal, you as a parent should know what other options exist, and then only you make your choice, So even though they are adamant or they have done their research and they just want to go ahead with the procedure, I still take my time, I sit with them and I'm like, no, you understand all the options. Then only you make your decision. So then like it's their response. They're like, yes, doctor, we should know the options and thank you for telling us that. Like we were just thinking this is the only option available. So you as a dentist, whatever options you have studied, and your heart knows what options are there. Don't try to just make money out of it. Ethics is one thing which is getting massively compromised in today's world, taking advantage of the patient's ignorance. You will be a patient someday too, in some other aspect which you're not knowledgeable. Wouldn't you want your doctor to give proper options and choices to you, and that you should be making a treatment out, you should be making a decision based out of all the options given to you in your own just and free and calm way, not a pressurized way, right? So which ethical principle is breached? It's informed consent. Understood? Our colleague regularly arrives intoxicated. What should you do? Okay, I have not experienced such a situation yet, but of course, when somebody's intoxicated, their decision gets clouded. their judgment is not reliable, their actions are not so disciplined and professional. If you have seen somebody who's intoxicated, you'll know about it, right? So, what do you do? Now, if you're working in a practice and you see your colleague coming like that, who's the first person in danger? The patients. The patients are coming, sitting on the chair, and if the treating doctor is not in a state of competence, he's going to harm the patient. There's a likelihood of harming the patient. You, as a doctor, what are you going to do? You're going to report to the appropriate regulatory body, correct? You're not going to ignore the situation, no. As much as people love not to interfere, saying it's none of their business, injustice needs interference. Injustice propagates, crimes propagate when good people keep their mouth shut. Now, if it's your practice, you cannot ignore the situation. Confront them publicly? No, you're not going to do that. First of all, that colleague is intoxicated. Half of the things that you say he's not going to listen. Plus, it would be humiliating and embarrassing. And why would you want to do that to your own colleague in public? No. Cover for them if possible. No, you're aiding, abetting a crime. No, no, no. You're going to regulate. And let the managers speak to the colleague and do whatever decision is necessary. Advertising your service with false qualification violates what? Autonomy? No. Professional integrity? Yes. Patient confidentiality? You're not disclosing anything of the patient. Competence? Now, if I were solving this question, I could have been confused between professional integrity and competence. But again, my competence is my skills, so that is not in question here. But my professional integrity, yes. When you say you're going to a professional, for example, say I'm going to an eye doctor, okay? What I'll do, I'll Google the profile up and I'll read the degrees. Now, if in the degrees it's mentioned MBBS and then MS, then I know the doctor has done her qualifications, his or her qualifications. Now, if the doctor is just a general practitioner as an MBBS but mentions MS, and later on I come to realize after visiting the doctor that the doctor is not a specialist, won't I doubt everything that the doctor has said? Won't there be a breach of trust? Because why would you advertise something which is not there? Then you might think the doctor might do something which is not there. You'll immediately start questioning the trust and the faith on the doctor that you need to have, because you're placing your health in the doctor's hand. So what you're compromising is professional integrity. And the last question of today before I scoot off to sleep. You accidentally damage a patient's adjacent tooth during a procedure. What is the ethical action? See, in today's world, somehow, with the social media and stuff, people just want to show only their success. People just want to show that they are perfect, because somehow failure, falling down, doing a mistake is considered as a sign of weakness or a taboo, or somehow people feel no. We just want an ideal thing. It's not possible. We are humans. You don't have to be perfect. You have to be authentic. You have to be genuine. You have to be honest, reliable, and responsible. This perfectness is just created by social media, by commercials. That is not the real world. But somehow people just see that and try to imitate it. And in that, whenever a mistake happens, which it will happen because you are a human being, the fear of being caught or the fear of being exposed drives them to such an extent that they just want to cover it up. And in that, you will breach the ethics, the confidentialities. You would lie to yourself. You would live in a denial. And that should never be there. So, first of all, start owning up. You are a human being and you can do a mistake. What is going to lessen your mistake is practice, consciously awareness, conscious awareness. Basically, you're consciously aware of whatever you're doing, you're present in the moment. Only when all these things are there, the likelihood, the chances of you committing a mistake would be less. But even if accidentally you do that, accidents are not in anybody's hand, they can happen at any point of time. You should immediately inform the patient. You understand? What will the patient do? The patient will actually appreciate, because before doing the procedure you have explained them the risks. It's a treatment, it's a risky procedure. You're trying your best not to do any mistake or an accident, but if it happens, it happens. But what you will not do is, don't mention it unless they notice. No, that's wrong. Inform the patient immediately and document it. Blame another staff member. No. Offer a refund but avoid responsibility. No, no, no. You own it up. You own it up. And honestly, the patient is going to respect it. Honesty and accountability are core ethical duties in clinical care. There are times, when a child is like really, really uncooperative, and I'm trying to drill a cavity and it's on the lingual surface of the tooth, and no matter how hard I'm trying, I've already informed the patient, accidentally sometimes the bird can touch the tongue and a little bleeding can happen if the child is really uncooperative. But it's just one cavity and you don't want to post the child under GA. The child is not accepting nitrous and the patients are like, doctor, we'll hold the child, just please finish off this cavity before it goes to the stage of root canal. So there are times when, no matter how hard you try, just in the procedure of you finishing off the cavity drilling, sometimes accidentally the bird kind of touches the tongue a little bit. Not to cause the pain, but a little amount of bleeding does happen. What I do immediately, I immediately inform the patient. You see there's a cut in the tongue, like I explained. We tried our best, but you can see how much the child is moving, and the patients are actually seeing, the parents. They are like, yes, doctor, we saw it. It's all right. That's their response. Doctor, we understand. We are seeing the procedure, and they are like literally yelling at the child that stop moving the tongue, stop doing this. And I tell them, you know what? Don't yell at him. It's his fear response. But this was like going to happen. Like no matter how much hard you try, sometimes it happens. But it's gonna heal, and I'll give you a gel to apply, and you apply that. The patients are very happy, the parents, like they are like, yes, you explained it to us, this happened, you informed us, we are okay, we are okay. So they actually appreciate you. So you don't have to be scared. My point is, don't be scared. It's okay to commit a mistake. Everybody does that at some point in time. If you have not done a mistake, that means you have not worked at all, honestly. There is no way that you cannot commit a mistake if you have been working. No matter how much experienced you are, some things are just out of your hands. I won't say it a mistake, I can call it as an accident. But things do happen. Just own it up, That will show your integrity, your honesty, and the fact that you genuinely care, and that's why you've explained the consequences. You're not bluffing that nothing will go wrong and everything is gonna go smooth. No, things can happen, but you're competent enough to handle it. So that's what makes a good doctor. So anyways, ethics is like a lot to say, because it's like how you practice. There is no hard and fast rule, but ethics is something. It's not a subject that is taught in dentistry, or at least in dentistry. I don't know about other professions, but I seriously feel that this is something that should be spoken out loud when children are being taught, when students are being groomed. It's not just the subjects, how to do the procedure, it's how to deal with the patients. But the problem is, when you're in college, and it's mostly charity-based colleges, right, where the patients come and get the treatment done for free, it's mostly the lower middle class population that just comes to get the treatment done. And so there's barely any communication that's happening with the patient. It's like they have come, a paper has come to you, the OMDR department has done the examination, it has taken the x-ray already, it has referred to you for a root canal, etc., etc. You're just focused on how to get the tooth treated, because your focus is there, because you want to learn that part. The part where you actually communicate to the patient, understand the whole and soul of the patient, is never there. You're never seeing one patient thoroughly yourself. Even if you have done the root canal and now you have to give a crown, you refer the patient to the prostho. So it's not like you are managing that whole patient yourself. But when you come to the clinical practice immediately after graduation, you have to handle that entire patient yourself, right? You see the difference, what I'm saying? So that kind of lacks in the college where you solely are responsible for one patient, A to Z, everything. I don't know how that teaching method can be changed, but I think it's high time that method gets disrupted and this method comes in. But at least 10 patients you should be managing, whole and soul. Then only you will communicate with the patient and form a relationship with the patient, a professional relationship. And that will give you a good start when you start practicing. You won't be afraid. So, yeah, that's about it. Let me know if this resonates with you, whatever I have said, if you have experienced any of these things. It's nice to discuss. Just today, I was on Instagram going through one video where Roger Federer, the tennis legend, was just giving a speech in a students' graduation ceremony, and he was like, "It's okay to lose, but you. I mean, if you want to cry about it, you cry about it, but you get up, and you start playing again. You start practicing again. You be relentless. It's only human beings. We are just human beings, and we lose points." He was talking about his tennis games. He's like, "I may have won 80% of the matches, but if you see the points, I've just won 54%. So that means I've lost almost half of the points, just like the other player. It's okay. It's just a point. You lose. Then you focus on the next point. Similarly in life, you have a relationship, you have a job, you have some goal. If you lose, it's okay. Just get up and start focusing on the next one. Don't get attached to the loss. Don't feel what the world is gonna say. Don't care about it. Just focus on your inward journey. Yeah, a lot of soul searching I did, so a lot of these things are gonna come out in the next couple of videos. But yeah, it's just given me more depth to my character and to my soul. The more deep I dive, the more superficial the world seems, and the more futile our materialistic pursuits feel. So, anyways, I hope you like this video, and if you want more of ethics and professionalism questions, which anyways I'm gonna do, just leave me a message and I'll try to cover more questions instead of just 3 or 5, because just these have taken such a long time. So yeah, your messages mean a lot to me. Comments or email, and yes, this book has like around 440 SBQs based on just all the topics that I showed earlier. So yeah, if you want to have this book, see all these topics, just email me on adcwrittenmocktest@gmail.com and I'll send you the details. Okay. Good night. Bye bye.